Good morning and welcome everybody. We thank you for joining us this morning for this short training. The Bureau of Family Health welcomes and thanks everybody for joining. And just in case you don't know who the Bureau of Family Health is, we are under the Louisiana Department of Health and sit under the Office of Public Health. We administer things like the newborn hearing screening program, newborn heel stick program, genetic screening, home visiting, and many other programs that ensures families' health in Louisiana. Julie Emery is our speaker this morning, and she is the Pediatric Provider Engagement Consultant with the Bureau. She leads the Louisiana Perinatal Quality Collaborative Caregiver Perinatal Depression Screening in Pediatrics Pilot, and I am sure you will enjoy the training this morning. And again, thank you for joining. If you are seeking CEs, you will receive a link to the survey, which must be completed, the evaluation at the end of the program. Thank you so much and have a great rest of your day.
Thank you, Patty. Good morning, everyone. Thank you for being here with us this morning. So I'm here to talk to you guys a little bit about perinatal depression screening, an overview of perinatal depression, some screening tools that you can use in your practice, and then how to develop some resources for that. Like Patty said, I'm the Pediatric Provider Engagement Consultant for the Bureau of Family Health, and I'm currently working on a pilot specific to pediatric clinics and how we implement and incorporate perinatal depression screening specifically in pediatrics for caregivers. I do not have any disclosures, any relevant financial relationships or companies to disclose. Okay, so let's talk a little bit about perinatal depression. Maternal mental health disorders is the most common complication of pregnancy and childbirth. It impacts an average of 1 out of 5 mothers, which is about 500,000 women per year. In the United States, it's estimated that more than 400,000 infants are born to parents who are depressed on an annual basis. Rates are even higher for birthing parents who are facing economic hardships in certain racial groups. So, for example, rates of maternal depression are more than doubled for Black women versus white women. So we know that perinatal depression is not only detrimental to the perinatal health of that birthing person, but it can also have long-lasting negative consequences on that developing child, because we know how important that first year of life is. And so a child experiencing a caregiver who may be facing depression, have depression or anxiety symptoms, is going to have a negative impact of how they develop and how they experience their first few months of life. Having a caregiver who is in distress, that puts a higher risk for a child experiencing maltreatment. And then perinatal depression has also been linked to, of course, a reduced sensitivity and responsiveness in caregiving, which consequently is poor social, emotional, cognitive, language, motor, and adaptive behavior within the development of a child. They're missing out on that early connectiveness, the early bonding. There's also evidence that shows that that caregivers who are depressed or birthing mothers who are experiencing depression, they may end breastfeeding earlier or not even initiate. And then also there's evidence that shows that perinatal depression puts children and adolescents at risk for their own depression. So while we screen for perinatal depression, it's simple. The earlier we can identify, the earlier we can intervene, which is going to lead to greater positive outcomes. Even if we are initiating the perinatal depression screening and there is not showing any kind of depression, it's also an educational tool for families. It helps them understand what are normal symptoms or normal experiences that they may have as a result of having a baby, and what the long-lasting symptoms that may turn into a depressive concern. So having that early identification conversation, allowing an opportunity to intervene as soon as possible, is obviously going to lead to greater positive outcomes, not only for that birthing person, but for the children they are caring for. So there's been multiple statements made by various prominent organizations that support perinatal depression screening. And these statements are all the way back to 2010, where the perinatal depression and pediatrics specifically really began gaining a lot of steam. And so the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the U.S. Preventive Services Task Force, the Centers of Medicare and Medicaid Services, the American Medical Association, as well as the American Psychiatric Association. All of these organizations have put out a statement in their own words supporting the occurrence of perinatal depression screenings. So when should we screen? So the Louisiana Developmental Screening Guidelines has a periodicity schedule for all types of screening. So when we look at perinatal depression, the recommended times to screen is going to match exactly with the American Academy of Pediatrics guidelines. And so you want to screen, if we're looking at a pediatric setting for a well-child visit, we want to screen at 1, 2, 4, and 6 months well-child visit. It is important to make sure that screening is happening at all 4 of these time settings. Sometimes a caregiver may need a little bit more time to disclose what they're feeling. It may be that they're not feeling something at 1 month, but then it comes at 2 months. And it's also important to let the parent know, or let the caregiver know, that these are coming at the 1, 2, 4, and 6 months, so that they don't feel targeted in any kind of way. It is a universal screening that we screen all caregivers at these well-child visits. And then also, when they know that it's coming, it creates a little bit of a safety net that maybe they didn't disclose at 1 month, but they know that they'll be able to disclose at 2 months if they need further services. So the Louisiana Developmental Screening Guidelines also has recommendation for various screening tools. Looking specifically at perinatal depression, we have recommended the PHQ-2, as well as the PHQ-9, and then also the Safe Environment for Every Kid SEEK, which we'll talk a little bit about in just a minute. The SEEK has a one-time nominal fee. However, the PHQ-2 and the PHQ-9 does not. So the PHQ-2 is a 2-item instrument that is designed to identify adults at risk for depression in a primary care setting. A positive result on either one of the 2 questions indicates that they are 3 times more likely at risk for depression. The PHQ-2 is also embedded in 2 other screening instruments. So the SEEK, which was mentioned, it is an environmental risk screening tool. It looks at barriers to health. And the PHQ-2 questions are within the SEEK screening tool. And we know that a lot of times that things that a family may be experiencing, like domestic violence, things like that, can contribute to perinatal depression. And so if your practice is implementing the SEEK, you are also implementing the perinatal depression screening within that. Another screening tool that it is embedded in is the ECSA, which is the social emotional development screening tool. So if you look specifically at the PHQ-2, it is just 2 questions, and then ask questions regarding their experiences in the last 2 weeks. Primarily, most practices look at 3, like a score of 3 to be a positive screening tool for the PHQ-2. And at that point, if you have a positive on the PHQ-2, you want to initiate the PHQ-9, which asks a little bit further and more in-depth questions. So a couple of other screening tools that you can consider for perinatal depression screening, like I said, is the PHQ-9. You do not have to do the PHQ-2 first in order to initiate the 9. You can specifically just go and start with the PHQ-9, which has 9 questions. Also, the Edinburgh Postnatal Depression Scale, that is a 10-item question, and versus the PHQ-2 and 9 that ask questions about the last 2 weeks, the Edinburghs ask questions about the last 7 days and their experiences. So they look at what the PHQ-9 looks like. Like I said, there's 9 questions, and it's scored from not at all, several days, more than half the days, and nearly every day. So some questions it may ask about trouble falling or staying asleep or sleeping too much within the last 2 weeks. The most practices use the score of 5 as when we need to go into the next step for referral as a positive on this screening. If we look at the Edinburgh Postnatal Depression Screening, this one has some reverse scoring, and so it's a little bit different, but it again looks at 7 as in the last 7 days of something that the caregiver may be experiencing. One of the questions looked like, have I blamed myself unnecessarily when things went wrong? And so it asks for most of the time, some of the day, not some of the time, not very often, and never. So some key points that I really want to pull out when you're thinking about implementing a perinatal depression screening into your practice is you really have to think about trust, because you want that caregiver to feel comfortable disclosing and also feel respected if they do not want to disclose. It should always be the caregiver's option to not complete the screening. It's not a requirement. It should never be a requirement or mandatory. You want to build that relationship and build that trust. Again, why it's so important to not just do the screening at the 1-month well child. We want to continue doing it and have that opportunity to develop a strong relationship with the family so that they feel comfortable disclosing any concerns that they may have. Scripts is also really important to think about. We want families to understand that this is a universal screening. This is not anything targeted. This is not specifically for them. This is something that we, as a practice, we care about your family's well-being. We care about what's happening within your family. And it is important that we're able to provide the supports that you need if there's any challenges or concerns. So really thinking about what those scripts look like, whether it is an introduction on paper or an electronic of why they're completing the screening. Also thinking about scripts of whoever is handing the screening to the family, what are they saying? And then also the scripts of when you are scoring and you receive the results to the screening. What are we saying if there's mild concern? What are we saying if there's moderate concern, if the family needs to be referred? Or then what are we saying if it's an emergency? What are our next steps? So making sure those scripts are in place and that they're universal and they are supportive to the feelings and the understanding of the caregiver that you're screening. You also want to make sure that your staff is fully trained on, number one, all of their language, all of the referral options, who's following up, what are you saying? Are we making sure that we have respect and equity in mind for the families? So all 3 of these are really big components of getting ready to implement these screenings into your practice. We don't want to just go in and just hurriedly put a new screening in place. We want to make sure that all of the protocols and all the practices are there, that it's a strong foundation so that we can just further support the family that is coming into your environment, and we can provide those resources that they need. Okay, so you've got a positive screen. Now what? We want to make sure that caregivers understand that a positive screen does not mean a diagnosis. This is just the introduction to next step, and you want to answer your questions to the best of their ability. Keeping in that full family support mind, how this, sometimes you may have to answer questions of why this is important, why you're being screened in a pediatric clinic, because this impacts your child. And we want to make sure that you have all the resources that you need so that we can get you healthy and your entire family healthy to be supportive for that new child. If you're not in a primary practice, so if you're completing these within a pediatric setting, then we want to make sure that we're referring that caregiver back to their primary care provider. And then also making sure that we are supporting families with community resources. And that's going to take a little bit of work to develop what your community resources are. Before you go into the implementation phase, you want to make sure that you have done your adequate research of what is available in your community. And also look at your environment as a whole. If you look at your waiting room, if you look at your practice visit room, what does that say? Are we taking any opportunities to normalize mental health for families? Is there posters we can provide? Is there things, again, just making this normalized that we're there to provide these screening and support? And then are there community resources that are relevant and can be used for perinatal depression screening? So we know that we want to refer back to the primary care provider. We know that if there are mental health services within our own practice, that we can refer there. But a lot of times, as you may know, there may be a long waiting list. So within your community, are there any peer groups that are available? Are there any church groups? Are there additional things that they need in terms of barriers to health, like food insecurity, that you can help them find a resource for that will help kind of support that well-being in the home? Is there a national hotline that you can provide those services so that if they need to speak with someone immediately, they can do that? You as a provider have access to some consultation to help find those resources as well. But you want to make sure that you do your due diligence on knowing where you're going to refer. Where do you go if it's a mild positive results? Where do you want to refer to? And like we said earlier, the moderate, and then of course the severe, that we need to respond immediately. The Louisiana Developmental Screening Toolkit, this is the website for it, and that is one of the resources that you can utilize that has already done some research on family wellness and environmental resources. So you can go to that link, and it is by region. So this one right here that I'm showing has the Orleans, East Jefferson, and West Jefferson, and it is resources that is specific to that area. And so when you go to the link, there is a map of Louisiana by parish, and you can click on that parish and it'll give you some resources that may help with family wellness within your own community. This is a starting place, but we know that communities know their own communities best. And so sometimes it just takes asking questions and asking, what churches are available to support. Like I said, are there mom groups that we can connect? Is it this family just really needs to have a social support circle? And so before implementing the screening, you really want to make sure that you have developed the best resources for your community so that you can respond appropriately. So Patty, take an opportunity to answer questions? Can a link be dropped in the chat? Yes, absolutely.
Yeah.
Okay.
So if anybody has any questions they'd like to pose, please drop them either in the Q&A section or in the chat. Oh, someone wants to know, can the link be dropped in the chat, Julie?
Yes, it can. Patty, can you do that, or I can stop sharing and do it?
I'd have, let's see. I'm getting there.
Okay, it's fine. So if anybody has any specific questions, go ahead and drop them in. Okay, Patty has dropped the direct link to the interactive map that's got some family wellness resources.
All right. If there's no other questions, thank you for joining us today, and look for the link to the evaluation survey, and we hope to see you at future trainings.
Thank you.